Alcohol, Tobacco, and Other Drug Prevention and Intervention, a training program for all school faculty members. Faculty training on substance abuse is important because we care about student health and safety, because faculty members serve as the eyes and ears of the school, and because it's the law. Part 1. Alcohol, Tobacco, and Other Drugs of Abuse, Data and Trends. In this section, we will focus on the drugs of abuse among our nation's youth and provide an overview of some of the more important trends in alcohol, tobacco, and other drugs. The following data was obtained from the Monitoring the Future survey conducted each year by the University of Michigan with funding provided by the National Institutes of Health. The three most common mood-altering substances used by children and teens in the United States are, in order, alcohol, then marijuana, followed by the non-medical use of pharmaceuticals, which include both prescription and over-the-counter medications. Alcohol. In 2014, the percentage of students that reported at least one episode of alcohol consumption other than a few sips were 8th grade, 27%, 10th grade, 49%, and 12th grade, 66%. Although these numbers are strikingly high, they do represent a decrease in alcohol use among youth over the past 5 years. Lifetime use of marijuana for those grade levels were 16% among 8th graders, 34% among 10th graders, and just over 44% of 12th graders reported at least one episode of marijuana use at some point in their lives. Here you can see the percentage of 8th and 12th graders who have used drugs other than alcohol in the past year. As you can see, marijuana is the most common drug of abuse. Although this graph ranks specific drugs separately, when considered as a group, the illicit use of pharmaceuticals comprise the next most commonly used drug among teens. Pharmaceuticals include prescription medications such as opiate pain relievers like Vicodin, Percocet, OxyContin, sedatives such as Xanax and Valium, sleeping pills such as Ambien and Lunesta, and stimulant medications for treating ADHD such as Adderall and Ritalin. Pharmaceuticals also include over-the-counter medications such as decongestants and cough suppressants. For teenagers who abuse prescription drugs, the majority get them for free from either a friend or a relative. You may pause the video here to familiarize yourself with the types and relative frequencies of drugs used by 8th and 12th graders over the past year. This graph shows which drugs are most often the first drug to be used by teens. At over 70%, marijuana is clearly the most common drug that illicit drug users begin with. Next most common are prescription pain relievers, followed by inhalants, which are more common among younger teens. This graph shows the percentage of youth that have used cigarettes, electronic cigarettes, or smokeless tobacco in the past month. Past month data is considered an indication of somewhat regular use or habitual use. 2014 was the first year that the Monitoring the Future study assessed the use of electronic cigarettes. It is important to note that e-cigarettes, which is also called vaping, has surpassed the use of both traditional cigarettes and smokeless tobacco. Here again you can see that electronic cigarette use has bypassed all other forms of nicotine ingestion at all three grade levels. Trends. First, the good news. As you can see in this graph, the use of alcohol and tobacco products continues to decrease, as well as a slight decrease in the use of several illicit drugs, including the non-medical use of many prescription drugs. But while most drugs other than marijuana has stabilized or declined over the past decade, marijuana use has increased in the general population since 2007. In 2013, there were 19.8 million current users, about 7.5% of people aged 12 or older, which is up from 14.5 million in 2007. Although there is a downward trend in alcohol consumption, there is still a lot of drinking taking place among our nation's youth. Approximately 1/4 of all 8th graders, 1/3 of all 10th graders, and approximately 2/3 of all 12th graders reported having at least one drinking episode. In summary, the most commonly used mood-altering substances are, in order, alcohol, marijuana, the non-medical use of prescription and over-the-counter drugs, followed by all other drugs. Part 2. Warning signs. Identification, intervention, and reporting. In this section, we will explore the signs and symptoms of potential drug use and review the reporting guidelines when you suspect a child might be under the influence. Please note, when it comes to concerns regarding students, we must distinguish between two different levels of concern, each requiring a different level of urgency regarding intervention and notification. You may have general concerns about a student, noticing certain changes over time. Perhaps you've heard rumors about a student's involvement with alcohol or other drugs at parties or around town. Although you have concerns, there is no present evidence of current intoxication. On the other hand, you may be concerned that a student is presently under the influence of alcohol or other drugs. These two concerns are both important but must be handled differently. General concerns should be raised when you notice a significant change in a student's academic performance, general behavior, social life, emotional functioning, or attitude. Immediate concerns should be raised when you observe any physical or cognitive impairment, difficulty, or abnormalities such as problems with bodily coordination, breathing, speech, or problems with alertness, arousal, or agitation. Let us examine each of these concerns and review the common indicators. General concerns. General concerns include decreased academic performance, either in terms of grades or participation. Excessive school avoidance, either cutting class, zoning out in class, or avoiding school altogether. Decreased energy or motivation in academic as well as extracurricular activities. Significant change in friends or isolation from others. Arguing that drug use is appropriate or that drugs should be legalized. Neglecting grooming or overall appearance. Excessive secrecy, evasiveness, or lying. Involvement in criminal activities. General concerns do not necessarily indicate a problem with alcohol or other drugs, but do indicate that something is wrong. Many other factors can cause these symptoms and require an appropriate assessment by a qualified professional. Other possible causes include depression, anxiety, relationship issues, school phobias, family problems, child abuse or neglect, trauma, mental illness, and many other issues. Reporting. If you have general concerns and observe any of the above symptoms or behaviors, you should report your concerns to the appropriate faculty member. In this school, this would be the school counselor, student assistance coordinator, school psychologist, or guidance counselor. It may also be appropriate to notify a school administrator, parent, or others responsible for the well-being of that particular student. The important difference between general and immediate concerns hinges on whether you suspect a child is currently under the influence. General concerns about a student relate to academic, behavioral, social, emotional, or attitudinal changes, but do not reflect concern that a child is presently under the influence. Immediate concerns, on the other hand, should be raised if you suspect that a child is currently impaired. Current impairment should be suspected if you observe physical, cognitive, or any bizarre behavioral symptoms. We will now review these symptoms in more detail. The most common sign that a person is currently under the influence includes a lingering odor of alcohol or other chemicals, impaired thinking, including bizarre statements or reactions to others, decreased coordination, such as stumbling, falling down, and staggering, difficulty breathing, most likely labored or shallow breathing, but also rapid breathing and hyperventilating, slurred speech, or rapid or rambling speech, unusually dilated or constricted pupils, where the pupils appear unusually large or small, as well as red or bloodshot eyes, or involuntary eye movements. excessive listlessness and inability to arouse, unexplained or unusual laughing or giddiness, extreme anxiety, agitation, or tremors, dizziness or vomiting, paranoia, disorientation or extreme confusion, and psychotic or violent behavior. Just as with general concerns, the warning signs of present intoxication do not necessarily indicate the use of alcohol or other drugs. Certain medical conditions can mimic the signs of intoxication. These conditions include, but are not limited to, diabetes or low blood sugar, medication side effects, seizure disorder or epilepsy, concussion, severe dehydration, sleep deprivation, psychosis, stroke, heart conditions, severe allergic reactions. As you can see, these medical issues are quite serious and, like intoxication, require immediate medical assessment and intervention. If you suspect that a child is currently under the influence or is exhibiting any of the above symptoms, you must notify a school administrator and medical personnel immediately. The use of intoxicating substances is not just a potential violation of school policies and laws. It represents a potential medical emergency and must be addressed as such. Alcohol and other drug use can lead to overdose, accidents, or other serious medical conditions, as well as violence towards oneself or others. Regardless of whether the results of a medical assessment confirm intoxication, another medical issue, or nothing at all, it's important to remember that the primary motive for identifying and reporting these symptoms or conditions is student safety. Therefore, staff members should never feel responsible for possibly getting a student in trouble. Rather, they should see it as potentially saving a child's life. In summary, if a staff member has general concerns about changes in a student's overall behavior, academic performance, socialization, or emotional functioning, they should notify the school counselor, school psychologist, or other appropriately trained mental health worker, as well as other adults who are responsible for the child's well-being. If, on the other hand, a staff member observes any sign of possibly present intoxication or other medical issue, such as difficulty speaking, breathing, remaining alert, or maintaining coordination, or any bizarre, unusual, or disoriented thinking, they must see it as a potential medical emergency and immediately notify a school administrator and medical personnel. Finally, it is important to remember that if you are concerned about any current medical issue, potential substance abuse, bullying, domestic violence, suicide, or any other issue where a student may be in immediate danger, you must notify the appropriate staff member directly, either by phone or in person. Do not just leave a message and do not rely on email, as the person you are notifying may not receive the message in a timely fashion. If you have any questions, please feel free to notify a school administrator or Mr. Yeager directly. Thank you for your participation.